You know, I do manage a lot of men with obesity, right now we've had a lot of advances in the care of obesity. What I always try to make the client recognize is the fact that obesity is one of the most common risk factors for cardiovascular disease. So we identify that first. I don't want you to have a heart attack. So there has to be a drastic lifestyle change first, because medicine is not all the cure. There has to be a lifestyle change. I have a couple of clients on Ozempic, Mounjaro, semaglutide, but they still want to eat. I've had clients I had to cut off because I said, you don't want to do the lifestyle change. We can't just be on medicine forever. This medicine is for you to start your journey. Once you start your journey, you have the lifestyle change, we're going to get off the medicine because now you're on the road. So if I had met you 2 years ago, we would have sat down, and I want to look at the whole picture. What type of stress are you dealing with? Because stress is a significant contributing factor to also weight gain because of the stress response hormone. One of the most common stress response hormone is cortisol, which is a steroid, cortisol, which is steroid. What a steroid does to you, too much steroid leads to weight gain and lead to insulin resistance, which could be a bit of diabetes. So we got to understand that first and say, okay, how much stress are you dealing with? Because when you deal with obesity, it has to be dealt with in a holistic way. We have to address here first. Then we talk about lifestyle changes. And however, based on certain BMI, there may be something drastic. Because if I see like you have high blood pressure now, you have high cholesterol now, compound with obesity, your risk of cardiovascular disease goes up significantly. So we may say, well, you know what? By virtue of your size, we may have to do surgery. That surgery with lifestyle change would enable you to start your journey. Because most patients that have obesity might be genetics. It's not all about food that you eat. Right. Not everybody that's obese eat too much food. It's just genetic. And that you cannot overcome that. That's why the surgery is important for some subset of patient population that have obesity. Right. But the most important part of it is address the mental part first. How are you dealing with stress? How much stress are we dealing with? How do we limit the amount of stress that we're dealing with? Once we do that first, then you can start your journey. But without addressing this, we're not going to get there.